I think I agree a great deal of what has been said on the other side, but I want to put the issue in a somewhat different way. If you're trying to figure out how you deal with health care, there are two ways that you could try to handle it. One is to create a system of additional subsidies in which you tax one group of individuals in order to supply health care to another, but to do nothing whatsoever to undermine the current system of crazy quilt regulations which drive up the cost of health care by creating massive sorts of inefficiencies which essentially drive down our ability to gain access to the health care system. In the introductory remarks, one of the most instructive things that were said was that the percentage of people who are insured by employer plans has dropped from 69 to 60% in the last decade or so. And the question I ask you to ponder is, why is it that that particular decline has taken place? And the answer isn't because health care is less important today than it was then. Everybody knows it's as important now as it ever was. But if you start looking at the system of regulation and mandates that have been imposed upon the system, the government that we're trying to work with, in fact, has become the greatest enemy to the provision of health care. Take, for example, just the simple question of imposing various kinds of mandates, so that when you want to buy health care, what you have to do is to purchase a package which is not determined by what the buyers and the sellers want, the employers for the employees. The government, who will be heavily influenced by interest group politics, will in fact put into those particular packages things that providers of these services are eager to sell at very attractive rates, but which consumers themselves may not want. And so what you will do is you'll get heavy neonatal coverage, you'll get alcoholism coverage, you'll get mental health coverage, a whole variety of mandates. And when it turns out that the employers and the employees don't like the mandates in question, what will happen is that they will essentially pull out of the system, leaving people to fend for themselves. So when you want to deal with the question of universal coverage, you have to ask the question, not only do you want to cover everybody, you have to ask them exactly what you're going to provide them and whether or not you have the budget to deal with the kinds of things that you need to provide in order to make this system go. And as I listen to what has been said by Secretary Bigby and by Ms. Herzlinger, it turns out you cannot balance the accounts. If you were to take something like Medicare, it turns out that the huge amounts of subsidy have led to an enormous amount of demand, and it's almost impossible to figure out exactly which people are overusers of the system and which are not. The reason we need a price mechanism is to ration. And if we do not ration by using prices, then we will have to ration in some other fashion. And the way in which we turn out to ration when we can use money is to queue. So there's no way in which we can achieve the impossible, which is to bring other people into the system, have a system of cross-subsidies, and to make sure that the level of care that is provided is as good for everybody who has private plans today after it is that you impose the government subsidies upon them in order to fund other individuals. It is, in fact, I think, when you look at this, a mistake to put the question in the form in which it is done. Let me just mention a couple of the problems. We talk about Americans having a fundamental right to health care. We have millions of legal and illegal aliens within the United States, and the question of whether or not they're going to be included on the cost side or the benefit side is one that we have to deal with. And it's wrong, I think, also to say that it's an obligation of government to secure these particular rights. Governments can secure no rights for anybody by the way of funding. Governments are a transfer mechanism between the individuals who pay and the individuals who receive. So the right question to ask in each and every one of these situations is, can we do better by a system of competitive markets and liberalization, or do we do better by having more regulation? And my answer is deregulate. Have, in effect, Walmart supply health care, and you'll do a lot better than having the state of Massachusetts. And that's the choice that you have. In effect, kill private enterprise and make government flourish, or allow private enterprise to come back in and to get rid of the queues and the incompetence and the overcost that mark the current system and will only get worse if we go down the path that's been suggested by the pros. Thank you.